Okay. So first, I just want to say how nice it is to see everyone again. And I'd like to call us to order at 6:34. Sorry that it's a few minutes late, sorry. And if we could all rise and just say the Pledge of Allegiance. I pledge allegiance
to the flag
of the United States
of America and
and
to
and
the
to the
republic
republic
for which it stands, one
one
nation,
nation,
under
under
God,
God,
indivisible,
indivisible, with liberty and
and
justice
justice
for all.
for all.
All right. And my screen share did not share. Sorry about that. All right, well, so Jean, do you want to do the roll call?
Sure. I see Heather, Shay, Maureen Lewis, Kebby, Catherine Tucker, and Dr. Muhammad.
All right, perfect.
Yeah.
And the review of the minutes, so this would be the August, we did not have a meeting September, October. That would be, did you all receive, I'm sorry that I'm asking you to go back in your memory banks. Do you have any questions about the minutes? Would you like me to resend them to you and we can table this for the next meeting, or is anyone comfortable accepting the minutes, making a motion to accept the minutes?
I think that was the meeting I missed, so I can't motion to that. I think I have to abstain.
Yeah, same, I think.
Did I miss it?
I don't even remember who was there.
All right,
You know
I'll
what? So
motion
why
to
don't we
table the minute.
table this? We're gonna resend them.
I'll motion to the table.
Thank you. Do I have a second for that?
I second.
Okay, Kebby and Dr. Mohammed. Just so that we can clear, it's been a couple months since we met, so I sent the agenda. It would have been easier to attach those. I apologize. So in the old business, we've been talking about, I'm just going to go to B first. I'm sorry to go out of order. For the discussion of the DEIB planning, I'd like to table this if it's agreeable to everyone, because we're still kind of exploring some different educational avenues.
Yeah.
And at this point, we don't have anything as a update.
Yeah, I think that's a good idea, because I really would like to be, thoughtful about how we approach that and come to the group with some real, thoughtful ideas. And I think it would be good to
Perfect.
table it. Okay.
All right. So Catherine, will you motion to table that? Are you motioning
Yeah,
to table that?
I make a motion that we table the DEI discussion until the next meeting.
Perfect. And any second? Discussion. Any second? Discussion?
Yeah, sorry, I'll second. I couldn't get my mute.
I was gonna say.
God, how many times that's like got to be like the phrase of the century, right? Or the
Yep.
phrase of the year. I'm
Are
sorry,
you
I was
muted?
on mute. Good grief.
Yep.
Right.
And I do this 1,000 times a day. I
All
don't
right.
know why I can't get it together. Sorry.
Me too. Well, that's all right. We're rusty for this. So, for this particular meeting. So let's go back to the updates regarding the COVID-19 local data, vaccination outreach, including the boosters, because I'm pretty
Maureen,
excited about that.
I'm sorry, Heather, do we have to have any discussion and then accept the motion?
I'm sorry, I did ask discussion. I'm sorry, I just moved on too quickly.
Okay.
But yes, does anyone want a discussion in regards to that?
Okay.
Okay. Hearing none, we'll table that.
Okay, thanks.
Thank you. So the COVID-19 vaccination outreach, including the boosters, the health department has been pretty busy getting the booster clinics up and running. There was one last week. I don't know if it was at City Hall or Noble Street, Maureen.
It was
The
at
first one.
City Hall.
That one was at City Hall. And then this weekend, we had one at the Fire Expo down at Savin Rock, and it was very well attended. So that was kind of exciting. But Maureen, do you want to give an update in regards to?
I do. May I share the screen?
Yep, let me give you.
Okay.
Let me give you.
I think I can. There's a little green thing here. Let me just see.
Yeah, it says you did. Yep, you can.
Okay, let's see. Make sure. I'm sure you can't see it. Can you see that?
I cannot.
Okay, then I guess I don't have.
Advanced sharing options.
Let's try it again.
It says all participants.
iPhone,
I
Safari.
can share the screen. You should go to shares. Should be allowed.
Yeah, you definitely have the permission.
And just usually when I hit share screen, I can see, it gives me a selection of files.
It's the pop-up. Yep.
And I don't see that. I don't see my files. All right, well, it's all right. I have slides, but I'll just read them. So a COVID-19 update. As of November 4th is when the state last updated all the town rates. West Haven's is 7.1%. That was our case rate as of November 4th. Now, it's weird because 1 week we'll have 35 cases, the second week we'll have 19. And lately it's been fluctuating so greatly by day. So yesterday we had at 8, today we had 0. And every day we see, and what I do is I try to think back, we try to think back to, were there any events? We're starting to wind down with events. So I do see that that's going to change even more as the colder months come. But for now, we're at a 7.1, and I believe that's going to change this Thursday. Just to give you an overall picture from the beginning of this, we had a total of 6,850 cases since the beginning, with 122 deaths. And as of today, 41,812 people tested. When you think about our population, it's quite a bit. Vaccine update. Our rates with all ages, at least one dose, having received at least one dose, 67.46%. Fully vaccinated, 63.15%, a total of 34,491 residents. Better than it was.
Yeah.
I do want to chat about our booster clinics. So yes, we did have one last Thursday afternoon. But we had a larger one at the Fire Expo, which saw 38 people getting vaccinated. We gave out 38 doses. That's very encouraging because toward the end of the first phase, doses 1 and 2, we were doing satellite clinics or clinics in the community where we just weren't getting anybody. One person maybe. Mm-hmm. Sometimes no one would show up. So, I mean, these aren't going to be just booster clinics. Let me just make that clear too, that anyone who still wants their first, second dose are welcome to come to these clinics. We have one this Friday from 11:30 to 2:30 at 201 Noble Street. It is for 65 and over. Everbridge call went out this afternoon about 10 of 5. I don't know if everyone heard that. What because we have, honestly, getting vaccinators sometimes is challenging because other, people have other jobs. We have 2 vaccinators this week, so there are limited slots. So people should call our office tomorrow by 5 because Thursday's a holiday. Get their slot. There will be more clinics next week.
Maureen, are you doing the flu vaccine along with it, or
No.
we'll have a separate?
No. Orange VNA did a flu vaccine for us for a couple of weeks ago. But no, we're not. We are having them once a week, but it's very possible that we could add additional clinics. We're dependent on vaccinators, finding vaccinators, so we plan as we have information and have available resources. We are vaccinating those who are currently eligible, which is the following: 65 and over, 18 plus who live in long-term care settings, 18 plus who have underlying medical conditions, and 18 plus who live and work in high-risk settings. We have Moderna only. However, it shouldn't hold anyone back. If they receive Pfizer, they can get Moderna. We are not going to have J&J this time around. And we are most likely going to require people to call first because the way the VAM system was updated is very cumbersome. And it will be easier if we have an idea of how many people are coming before doing walk-ins are good and all, but we think that we did a test run last Thursday. That's why we did a small clinic, and it really slows the process down. And we don't want any huge backups. We don't want people waiting in line for a long time. What else can I tell you about clinics? We are hoping, or we are going to hold one for educators. I spoke with Superintendent Cavallaro a little bit today by email, and we're going to try to, I'd like to do something special for them, and I just have to continue to chat with him tomorrow. And I think that's my update for COVID. The numbers are up and down. Amir, I think that you can agree, or maybe not, that as the weather changes, the numbers are going to fluctuate again.
Yeah.
I noticed the state numbers are high again.
Well, it will fluctuate. I think, what I see that communities that have better vaccination rate will fare better in terms of the number of new cases. And that will be the rate determining factor. So you may want to, for the board, I know Maureen has actively reached out, and there were some questions raised by the police department and emergency personnel that you address the FAQs, right? So you want to let the board know, and I kind of looked at it, looked very good to encourage or at least give confidence for these folks who are, the essential workers, right? And that's our target, to have those essential workers be on the job. But you're right. When I look at from the epidemiological lenses, I see cases fluctuating. We are much better. Both West Haven and Orange are in yellow category, right? Which is less than 10 cases on average of 2 weeks. This may or may not get higher based on the overall infection level, but I think if we can achieve 70-75% of vaccination rate, really will help us getting back to the baseline, sort of a regression towards the mean. So let's see. So those efforts are commendable to vaccinate the community members. So each and every single shot counts. So
No, it does. And once again, I know that Joe Soto has paramedics from UNH who have offered their help. So we may be reaching out to them to get more vaccinators. I think that's it, Heather.
Does anyone have any questions or discussion in regards to all of this?
I
Questions
did
for,
want, I did want to add one more thing. I'm sorry. Pfizer for the 5 to 11-year-olds. I also spoke with Superintendent Cavallaro about that, what his thoughts are, and I don't know what kind of response we're going to get. I'm surprised at how few pediatricians are doing them in this area versus like in the Hartford area. I hope that changes. Amir, do you agree? I think that for us, I would like to see our kids vaccinated, but again, that's if parents want to take that route. I don't know what kind of response we're going to get. I am very adamant, though, about having pediatric trained clinicians doing this. And that's just Amir, maybe you could.
I agree. You know, I think there will be a lot of challenges from operational standpoint and administrative issues, that a lot of pediatric clinics will not be able to offer that, you know, for logistical reason. One of our volunteer vaccinator who helped us happens to be a mom, happens to be a pediatrician. She reached out and found out that out of, I don't know how many, only few pediatric clinics are willing to offer the vaccine. I agree. If I were to get my kids vaccinated, I would rather bring them to a pediatrician than to go to a CVS pharmacy. Look, I don't have any problem with the pharmacist. My sister is a pharmacist. And but I would, and I don't give my kids the vaccine unless it's absolutely necessary. I'm traveling the next day, so I had to give them the typhoid vaccine. They did fine, but you know what I mean. I, as a physician, adult medicine, I would rather have them. So 100% agree. A nurse who has worked in pediatric unit, a nurse practitioner, or a pediatrician would be the best. You know, my kids have always got, and so are yours, right? When you bring them to the pediatrician doesn't give them, the nurse who has been given shots to a lot of PD population, and that's the best thing. If worse come to worse, yes, I can give, but I would prefer to have a trained, medical personnel to give the vaccine to pediatric.
Well, I think that Neil and I will continue to talk about it, and maybe, I know that they've worked with Cornell Scott in the past, and if their nurses are interested, I'm not sure, the Board of Ed nurses, they want to do something, we're certainly willing to get the Pfizer, now that they've changed some of the storage rules. But again, and this Pfizer is different for the kids. So, it's going to be something that
it's a 1/3 of the dose, I was told.
Yep. Yes.
Some of
So,
my
it's something
colleagues-
that we've just started talking about. I failed to mention that. So that's something that we're talking about.
Right.
I can just say, just agreeing that I have a lot of parent friends who are looking for where their children in this area can get it, and it's Walgreens and the wait every place was booked too, so it's not as easy here to
Yale has opened it up to 5 to 11-year-olds, and their focus is primarily on kids now and not adults. So I don't know, they can probably look at the ynh.org sites and see where they're able to maybe sign up.
Oh, that's good to know, because I know originally it was not available when they were looking at Yale, because that's kind of where I sent everybody. So I'm glad.
It was just recent, and we actually just got an email, I think it was last week, that said that the focus is really going to be on the child population.
Okay, awesome.
The issue that I have is, and again, this is a good thing, these are big healthcare systems, they have the staffing level. But imagine it's from all over Connecticut, so you as a parent in West Haven or I as a parent in Orange may not get, appointment at our convenience. So what Maureen and I did when we were hosting local clinics in town or in cities were very, very feasible for many people, right? That kind of encouraged them. Hence the reason why we kind of accelerated to reach the so-called herd level immunity. If we would just, so my biggest concern is there's only going to be limited clinics available. We will see bottlenecking, and again, kids with the school system, they have to go after school and all that, factor into play. It will be interesting, but yeah, you only have Griffin and Yale and maybe a few other in northern part of Connecticut, and so it's going to be a big catchment area.
And initially, the doctor's offices could not administer earlier on. So now the doctor's offices are able to, but they choose.
They can get the vaccine provided they meet certain requirements, that they have storage and other things. So DPH will send them. They actually want this partnership from pediatric office and other, clinics. However, I think based on their, I don't know, liability or, do they have that much of amount of, staffing to address this? Because, it will be busy for them. And what's the return on investment, for the time? And we offered for free, right? We didn't care how long and how busy we get. We were focused with one goal. So so different priorities. The mission is the same, but different priorities. And I think that would be challenging, and it'll remain to be seen how things would work out.
Yeah, definitely going to watch to see if anyone around here has it. Anyone else have any questions for Maureen in regards to any of these?
No, but just one thing, the Cornell Scott office that is on Campbell Avenue is administering the COVID vaccines as well to kids.
Is there a secret to how to get in touch with? But they're very.
You can go on I think you can schedule it right on the
no, I mean just
COVID portal
communications.
To get in touch with
It's
Cornell
not easy
Scott.
to get through to them.
I never have to call them. I don't know. But they're scheduling through the kids portal, the Connecticut kids portal. They're scheduling through that.
Okay. We can have what we're working on doing is putting together a list. Put it on social media. Mike Walsh can put up where people can go to get their children's vaccines with links.
But if that's good though, I mean, if Kevy is saying that they are doing it, maybe there is a partnership with the Board of Ed that something could be worked out too, even scheduling wise. I don't know, because
they're good partners, and I know that they've done it. They helped out last year. They did clinics at the high school.
I had no idea they were doing it, so that's great.
I think Board of Ed can also reach out to Griffin Health. They have mobile WAN clinics, and we just got a notification. I'm sure, Maureen, you have seen that Amity High School will be the site for other, maybe, it didn't go, but to all the elementary schools in Orange, they're hosting a clinic for pediatric population, and the location would be Amity High School.
Mm-hmm.
So they can partner with Griffin Health System to have them bring it. They would have their own staff, just like what they had been doing for, as long as they have the location or room available.
I found that reserving with Griffin is very easy. There's a link. You just go in and it's an intake form, and then you get an email back saying they received it, and then someone contacts you, and they just kind of do it all themselves. Very, very simple process.
Any more comments, questions for Maureen or Dr. Mohammed for that matter in regards to this? All right. So more to come in regards to this, I guess, to see where we go from here. I'm also going to defer to you, Maureen, in regards to new business, because we spoke with Bridges, and thank you for including me in that discussion in regards to their, I don't want to misspeak, van, bus,
So their primary care mobile clinic.
mobile clinic. I didn't want to call it something wrong.
Yeah, so they, though they have this large vehicle that they're having set up right now, or wrapped, as they put it. They need locations. They're going to be in the city, I think, 2 days a week. And
Yeah.
they're looking for permission or approvals to park this bus somewhere. And I think Heather and I, we talked about one day in Allentown, one day down on our end. And they're offering primary care services. They're offering, oh gosh, I can't remember. I don't have the list in front of me.
I do not, but mental health.
Mental health services, and they're going to also, they have them like the MATS van. They'll also be doing, addiction services, and I think it's fantastic, and it's exactly what, it's a true community public health effort, and I just don't, I'd have to find out where I need approval to get them to park.
And we were
somewhere
talking
today.
about, we were talking about with Cornell Scott now in the center is a good place. So then if the van is down Allentown one day, maybe towards the beach one day, or
Yeah.
maybe,
Not too close to Cornell because they are also offering the same services.
Right. But that way we're getting the community much more access to providers that maybe they wouldn't get to.
Mhm.
So I just, I wanted to add that to the agenda here so that everyone knew that this was a conversation that's happening. And like I said, thank you to Maureen for letting me be a part of that, because I think it's
Oh,
great,
yeah.
because the more access we give to our community, especially, people who don't have access, aren't on the bus line, get out into an area where is walkable, the better.
The other thing that we talked about, so I guess they're doing this in phases, and the first phase was adult care, right?
Mhm.
And I guess Heather and I talked about probably excessively the need for assistance for youth right now who are struggling. And they said, well, maybe we should move phase 2 up a bit because I think that there needs to be more for youth, young people.
I mean, my opinion is that's becoming pandemic in itself.
It is becoming it's since I know in our city as well, and since kids have been back to school, there's been a lot more problems, and not just our city, everywhere. But we speak about West Haven, and I think they heard us and they said, well, maybe we'll move that phase up quicker.
Yeah. So it's coming. There's a lot, there really is. I mean, with Cornell Scott happening, this happening, there is so much happening here that, I think it's great for our community. So
Yes,
anyone have any questions or discussion in regards to that?
Is Cornell Scott in West Haven or New Haven?
West Haven, both.
We have one in West
We have
Haven down
We have a
by
beautiful new center.
Yeah, the big one's in New Haven, like the addiction
Okay.
center and the inpatient. They have that small inpatient unit there up in New Haven, but they have like a small
Satellite
primary
clinic.
care.
Got
Yeah.
it.
satellite. Yeah. They're in, it's the old, I'm saying Keys, but that's not it. There was say that again?
Teacher and Bennett.
Beecher and Bennett, that's it. It's the old Beecher and Bennett building, right? Is that where it is? Yeah. So, and that's so central. Any other conversation, questions? All right. The one thing I told Maureen I was gonna mention tonight, I did not have it on the agenda, but in new business, I just wanted to mention some area churches Church of the Holy Spirit and Gateway have come together, and a volunteer coalition has been formed in regards to warming centers. And I explained to Steve, I know he was speaking, Steve Mullins was speaking to the council last night about this. And he had invited me to go to the meeting. I actually was going, you know, as a volunteer, but as the chairperson of the Board of Health, you know, that's how he introduced me. But I just wanted to make clear I was there as a volunteer, but I did want to present to the Board of Health that this was a collaboration between Gateway and is Jean, it's Church of the Holy Spirit, correct? I'm saying it right? Okay. That are coming together and have come up with a plan for the cold weather. I did talk to, you know, Maureen about it, because I think there's some challenges in regards to this, because the warming centers do fall under the health department as well. So I just wanted to make sure that everybody knew that this was happening, and that, you know, I have offered to be on the committee as a volunteer. And I just didn't want to misrepresent that I was representing all of us. But I do think that it's a great thing for our city to have someplace to go for members. And I actually have quite a few, I have quite a few coats currently in my house that I'm going to try to be working with Steve to get out to Gateway, as well as I want to reach out to councilperson Robin Hamilton. I understand with Vertical, they take these. I have about 7 giant bags full that I have. So I just wanted to present that to everybody. Maureen, I don't know if you wanted to add anything about that, or?
No, I mean, I think it's great too. But you're right that sheltering of any kind falls under Public Health Department and Emergency Management. And we have, it's actually required under state, under the funding we receive. And there are guidelines, protocols for sheltering that we have to follow. So, I mean, I think warming center is great. It's not something that I could do like as a health department member, but I think a private warming center is fine. But I think, Joe and I will still continue to do our sheltering as well, because we're required to.
So I just wanted to open that up to anyone, if anyone had any questions or had heard, about it, or, what it entailed or anything like that. But it is happening.
I did hear Steve speaking about it at the, I watched the city council meeting last night. It sounds like it's gonna definitely be a benefit for many of our folks. And I did think that he also said they were gonna work on a cooling center plan for the summer once we get through this season, that the church, I think he said it was Vertical Church, had said they would also consider, or Gateway. Yep, Gateway. That I knew I said the wrong name.
I interchanged the two of them in my
I do too.
So,
but it's the one by Veterans Field.
Yes.
Right.
Yeah.
Yep.
Exactly.
Yeah, they said they would be willing to do. Yep, they would be willing to do a cooling center too, which I think is also equally an issue.
Yep. And it's purely volunteer. It was very heartwarming. I mean, that's just the word that came to me, that the group of people came, problem solved from top to bottom, getting coats, getting, what should we have there? Should we have snacks? Maybe like some bags to, assist once they do leave the center, to bring with them. And so it's representatives from Gateway, Church of the Holy Spirit. I think the city as a whole does support it, but like Maureen said, the actual running of a city shelter would, I guess, fall to the health department. But, it's supported by, I think it's recognized that it's a real need for population. So I think it's going to be a great thing. And they're really willing to be there. I didn't write down the hours. I want to say 9. I can't remember the hours. It's the daytime hours, 8 or 9 to the evening.
I think it was till 5 o'clock. I think he said it was
Yeah.
till 5.
It's the daytime hours, and provide a snack. I don't know. I think it's going to be a great thing, and it's going to be initiated at 20 degrees. So when the temperature is forecast to be sustained at 20 degrees on a day, that's the low. That's daytime low, I should say. That's when it goes into effect. I think they're also working, and Steve had mentioned it last night, on bus passes so that people who aren't, in that immediate area have a way to get there, and getting the education out, having some information on sandwich boards that will be put out at central locations to sort of indicate, hey, there's a warming center now open, Gateway Church, where it is. So more to come, but I think, and I will say that was, Steve Mullins really, like he said last night, took it by the horns and really found a way. So hats off to him, hats off to Church of the Holy Spirit, Gateway. It was definitely a great collaboration. So just wanted to mention that, but I did want to just mention that I was there as a volunteer. I just didn't want people to think that I was representing us as a whole, but I do support it, whether I'm the chairperson or just Heather, because I think it's a great thing for our community that they're doing.
You're never just Heather. I'm just saying.
So anyway, just wanted to get that, discussed. And Jean, I'm sure you know all about it.
I do.
So yeah, it's a great thing. Any questions, conversation, anything? All right, well, that was all I had on the agenda for tonight, but is there anything more for new business that anyone wanted to bring up? That wasn't on the agenda. All right. So our next meeting will be the second Tuesday of December. I'm
going to let you know I will not be here.
Are you going to be in Florida?
I will be in Orlando with 3 cheerleading teams and potentially 1 football team.
Yay!
I just sent in my rooming lists for nationals.
And I am for my hips value, I am sending a monetary donation because I love that popcorn and it's extremely addicting.
Oh my God, isn't it the best popcorn ever?
It's the best popcorn.
Well, just so you know, the Seahawks have sold $20,000 worth of popcorn in 2 days.
Well, where is this popcorn?
I can text you a link.
Would you? Please?
Yes, I sure would. It's delicious. It's called Double Good.
You share with me too.
Let me just ask.
I'll put it in an email to everybody.
Yeah, do that, please.
Oh yeah, put it in our email. But yeah, I'm trying to think of what it was. It's like a double chocolate. There's a double chocolate or something that I ordered once. I was like, I could just eat this all day. I mean, I had Thin Mints for lunch.
You should eat it all day. No, that's not healthy.
Okay. But it's so good.
I know. I'm gonna go to Marine and eat popcorn.
So good.
My favorite is the Chi-Town Chow Down.
Oh, that sounds good.
That's an old one, but it's new back.
Chi-Town
Chow Down.
That sounds good. Kevin.
Caramel and cheese. Easy peasy caramel cheesy is also really good, but that's like each popcorn kernel has caramel and cheese on it. Chi-Town Chow Down has some caramel and some cheese mixed together.
Ooh.
So I don't know if you all saw the movie they did about me a couple of years ago. That sounds so self-serving. They came and they were doing like the cost of giving back or the benefit of giving back. I don't remember. It was like a documentary that they came and shot a couple years ago here in West Haven. They picked me from all the Pop Warner cheer coordinators that they had. So it's about doing good in your community, and those are the things that they support. They donate half of the proceeds to whatever fundraiser you're doing. So 50% of all the sales go back to you, and then 50% of their 50% goes back to charity on their end. They do like surfing with
that's
autistic
amazing.
kids. Yeah, that's why it's called Double Good. So not just
Oh,
because
I
it
didn't
tastes
know
really
that.
good. It tastes good and does good. So that's why they call it Double Good.
Wow.
Great company. If any of your kids have fundraisers at school
Double
or
Good?
whatever, it's Double Good. Yeah, it's amazing. It takes 10 minutes tops if you've never used a phone before to set up your event. You don't have to collect anything. You don't have to ship anything. You don't have to print anything, write anything. You literally type in the code, set up your store online. People buy it. They ship it to them. You get the money. They even do direct deposit into your account. That's my commercial for Double Good.
Let
Let me just take, if we're done, let me just take a motion to adjourn. If
I'll motion.
anyone,
Again.
okay, Kevy and Maureen, and